Hi, good evening, and welcome everyone to our live daily class. Today's class is little different. Today we are going to discuss different patterns of MCQs that are expected in an MDMS entrance examination, or I should say NEET PG entrance examination. So today's class is going to in this class we are going to see what are different kind of questions, because most of us commonly are associated with doing single best answer type of questions, and in our examination actually the most common format that comes is single best answer kind of an MCQ that comes up. But then there are some other formats in which MCQs are prepared, and if we have rehearsed those formats also, tackling questions in an MCQ based examination becomes little more easy. It's okay, little more identifiable. So today we are going to see 6 or 7 different kinds of MCQs that are part and parcel of an MDMS entrance examination. I am your doctor, teacher, mentor, Dr. Sumit Tellewar, who is bringing up this class in front of you live on this YouTube channel, which is aided by Unacademy, with all the 15 plus years of my experience of being in this area of coaching and mentoring the NEET PG or MDMS PG entrance aspirants. Okay. So before we begin our topic today, just like to share some important relevant information with you. अगर आप में से कोई भी मेरे साथ में अपनी कोई क्वेरी शेयर करना चाहते हैं, कोई सवाल पूछना चाहते हैं सब्जेक्ट रिलेटेड या आज के टॉपिक से रिलेटेड, प्लीज़ फील फ्री टू कॉन्टैक्ट मी एट टेलीग्राम ऐप. इसके लिए आपको अपने फ़ोन पे टेलीग्राम ऐप डाउनलोड करना होगा, एंड देन you need to follow this link, which is livedaily.me/neetpg, and your queries will come directly to me where they could be answered. For all those students who are currently preparing for their upcoming NEET PG examination, या फिर वो स्टूडेंट्स जो अपने NEET PG एग्जामिनेशन की तैयारी बहुत जल्द शुरू करने वाले हैं, क्योंकि उनका जो NEET PG एग्जामिनेशन का गोल है वो 2021 नहीं है, उनका गोल 2022 है. अभी उनके लिए थोड़ा समय है. इट्स एन एक्सेलेंट अपॉर्चुनिटी फॉर यू टू हैव अ लुक एट व्हाट अनअकैडमी ब्रिंग्स फॉर योर प्रिपरेशन. अनअकैडमी आपके पास लेके आता है 2 सब्सक्रिप्शन के ऑफर एज अनअकैडमी प्लस एंड अनअकैडमी आइकॉनिक सब्सक्रिप्शंस. दोनों ही सब्सक्रिप्शंस टेलर मेड हैं to suit the design and the study pattern of NEET PG aspirant students, with live classes in batches and schedules, also interactive classes, live polls, live test series, live doubt clearing sessions also. And by the way, अगर कोई student अपने live batch में अपनी live class miss कर देता है, still the student can go back to the library and see the recorded live session, और queries को अपनी अगेन लाइव डाउट क्लियरिंग सेशन में लेके आ सकता है एजुकेटर के पास. इट्स अ वंडरफुल इंटरफेस जिसपे ये सारी लाइव क्लासेस वेब बेस्ड टेक्नोलॉजी के साथ में डिलीवर होती हैं, और उसको हर एक स्टूडेंट देख भी सकता है. दैट इज एब्सोल्युटली फ्री ऑन स्पेशल क्लासेस, जो कि अनअकैडमी के प्लेटफॉर्म पे बिल्कुल फ्री है फॉर ऑल दो स्टूडेंट्स हु आर लुकिंग फॉरवर्ड टू प्रिपेयर और स्टार्ट प्रिपेयरिंग देयर NEET PG एग्जामिनेशन. सो माय रिकमेंडेशन इज फटाफट अनअकैडमी के प्लेटफॉर्म पे आइए, स्पेशल क्लासेस देखिए फ्री में. स्पेशल क्लासेस में, लाइव स्पेशल क्लासेस में एनरोल हो सकते हो आप, जो वैरायटी ऑफ वंडरफुल टीचर्स के द्वारा दी जाती हैं इन डिफरेंट सब्जेक्ट्स: एनाटमी, रेडियोलॉजी, फिजियोलॉजी, बायोकेमिस्ट्री, फोरेंसिक मेडिसिन, सर्जरी, पीडियाट्रिक्स, डर्मेटोलॉजी. इन स्पेशल क्लासेस का आप पार्ट बन सकते हो. आप अपनी नज़र से देख सकते हो किस तरीके से लाइव क्लासरूम वर्क करता है, और उसके बाद तुरंत आप अनअकैडमी को अपना सब्सक्रिप्शन पार्टनर चुन सकते हो फॉर योर नीट पीजी प्रिपरेशन। ओके, दो चीज़ों का ध्यान रखना है जब आप अनअकैडमी का सब्सक्रिप्शन ले रहे हैं। नंबर 1, टेक सब्सक्रिप्शंस विच आर बिगर सब्सक्रिप्शंस लाइक 1 ईयर और 2 ईयर, डिपेंडिंग अपॉन आपका जो गोल है नीट पीजी एग्जामिनेशन वो कितना दूर है। बिकॉज बल्कि सब्सक्रिप्शंस आपको मिलते हैं सब्सिडाइज्ड कॉस्टिंग पे, जिससे आपका काफ़ी बचत होती है। और दूसरा, बल्कि सब्सक्रिप्शन आपको कमिट करते हैं अपने गोल के लिए। ओके, तो बल्कि सब्सक्रिप्शन बहुत ज़रूरी होता है एक लर्नर के लिए अपने गोल की तरफ बढ़ना शुरू करने के लिए। और दूसरा, सब्सक्रिप्शन लेते समय यूज़ माई रेफरल कोड विच इज़ DRSUMITLIVE। ये रेफरल कोड आपको दिलाता है 10% डिस्काउंट ऑन योर सब्सक्रिप्शन ऑफर। चलिए शुरू करते हैं आज की अपनी क्लास। एज आई सेड, टुडे वी आर गोइंग टू डिस्कस different patterns or different kinds of MCQ that may come in our examination. Okay, so the subject we are dealing still remains forensic medicine. So we're actually doing two things in this one class. We actually are randomly discussing some forensic MCQs and simultaneously we are trying to tackle कि क्या different pattern of MCQs आ सकते हैं examination में. So the first kind of few MCQs that we are doing are single best answer type. Single best answer type most common पैटर्न है जो एग्जामिनेशन में स्टूडेंट के पास आता है। और वो क्वेश्चन किस तरीके के होते हैं? लाइक द क्वेश्चन इन ऑन स्क्रीन, इन रूटीन ऑटोप्सी स्पाइनल कॉर्ड इज ओपन्ड विद, एंड द ऑप्शंस आर एंटीरियर अप्रोच, lateral approach, posterior approach, or not opened at all. Okay, the correct answer in this case, we need to pick one single best answer which is a direct question to us. The correct answer is option number D. So when we say routine autopsy, four body cavities are opened mandatorily, and these are head, neck, chest, or you can say thorax, and abdomen. So in routine autopsies, doesn't matter where do we think the cause of death is, or even if the cause of death looks to be very apparent. Let's say we have an autopsy to be done on a body which has been stabbed in abdomen, and we know that the cause of death will be found in abdomen itself. Still, we need to open the other three body cavities also. So this is what it is done in routine autopsy. Special openings or special dissections are not warranted or not mandatory to be done in routine autopsies, like opening up of spinal cord. Okay, so opening up of spinal cord would be required in certain cases where we are either expecting some evidence that may be lodged in spinal cord, as in cases of gunshot injuries where a bullet has gone and lodged in the spinal cord or through the vertebral column. Then we might have to open up the vertebral column and spinal cord because we need to recover that bullet as a piece of evidence. Or we are expecting some trauma in the spinal cord or pathology in the spinal cord area to be the cause of death, like in cases of whiplash injury, okay, or maybe any kind of other spinal injuries. At that point of time, when spinal cord opening is important, if spinal cord opening has to be done, then available approaches are anterior, posterior and anterolateral. So the available approaches may be anterior, posterior or anterolateral approach to reach to the spinal cord if required, and the best approach is posterior approach. So what we are actually tackling in this question are three different questions itself. Number one, which is given on the board itself, that in routine autopsies spinal cord is open. The answer is it is not opened at all. Number two, if spinal cord has to be opened, what are the approaches available? Anterior is available, posterior is available, anterolateral approach can be made. Okay. And then three, what would be the best approach? And the best one would be posterior approach. Okay. Let's see another single best answer kind of a question. The question is, the true statement about cross examination of a prosecution witness is, okay, so there is a prosecution witness and cross examination is being done on him. What is the true statement? That it is conducted by a public prosecutor, or it is conducted by a judge, or cross questioning is allowed, or the first examination on witness during evidencing. The answer, by the way, is very simple. Cross questioning is allowed. Cross questioning is allowed, and an important aspect in cross questioning is leading questions can be asked. Okay, so whenever a witness comes to the courtroom, what is the sequence in which his evidence or witnessing is recorded? Witness has come to the courtroom for evidencing. Okay, the first thing that a witness has to go through is direct examination also known as examination in chief. Now this direct examination is conducted by prosecution lawyer, or you can say public prosecutor in cases of prosecution witness. Once the examination in chief is finished, then the second thing that happens is cross examination of witness, which is conducted by the lawyer of the opposite side. Okay, remember, lawyer of the opposite side conducts the cross examination, and the lawyer of the opposite side is defense lawyer. And the privilege defense lawyer has while conducting the cross examination of a prosecution witness is that he can ask leading questions and then he can cross question the witness himself. Okay. Okay, let's take the third question. This is again a single best answer kind of question. The question is, true statement about drowning is option number 1, it is always suicidal in nature, or option number 2, cadaveric spasm of hand is diagnostic of it being ante-mortem, option number 3, cutis anserina happens only in ante-mortem drowning, option number 4, putrefaction happens faster in water as compared to air. The correct statement is option number B, that cadaveric spasm, if present, suggests that it is an ante-mortem drowning. Now, when we talk about ante-mortem drowning, there are 3 very important diagnostic modalities which suggest the drowning to be ante-mortem only. The first one is cadaveric spasm present. The second one is presence of frothing from the nostrils and the mouth, and both of them can be seen or appreciated by naked eye. So you can say that these are macroscopic findings that suggest the drowning to be ante-mortem only. And third is diatoms test, which basically is a microscopic finding. If we do not get conclusive evidence from the body which has been recovered from water, so there are not conclusive evidences of macroscopic finding that are suggestive or diagnostic of ante-mortem drowning, then we have to look for presence of diatoms in the bone marrow sample of the body which has been recovered from water. Okay. Now, talking about the 2 macroscopic evidences, they are very, very important. Cadaveric spasm of the drowning, that will be seen in the hands itself, because when the person would be drowning, he would be using his hand vigorously, and as a result, all the ATPs from his hand will be washed off, and when he is ultimately sinking to the bottom of the water source, as a last resort to save himself, he may try to clench onto something that comes in his hands. That could be weeds or any other material that may be present in water. And because the muscles of the upper limb has completely washed off of all ATP, these muscles suddenly develop contraction, similar to rigor mortis. But rigor mortis normally takes time after death to develop because ATP gradually depletes. In this case, ATP has been depleted from the upper limb. So upper limb muscles instantly become stiff, and if that can be recognized from a body which has been recovered from water, it tells that it is definitely a case of ante-mortem drowning, because that tells us the struggle to survive. Okay. On the other hand, the second important macroscopic finding, which is frothing, which is coming from nostril and mouth, it is also very, very important. What happens is, when a person has fallen into water source, the more he shouts for help, the more water he inhales, and as he is trying to save himself, also his body is twisting and twirling in the water all the time. So whatever water is entering into his respiratory tract, it is constantly getting churned, and that churning of water produces lot of froth. and this froth being mixed with mucinous contents of the respiratory tract gets stabilized. So once the person is dead, his respiratory tree is all full of frothy fluid which starts to come out of his nostrils and mouth. The characteristics of this froth is that it is very fine, it is lathery, and it is tenacious, and you keep wiping it off, it keep coming back. Okay, so the characteristic of the frothing to identify that it is a drowning froth only is that it is fine, lathery, and tenacious. On being wiped off, it keeps coming back. So if we can see these kind of findings in a dead body, then we can say the dead body is ante-mortem in nature, because both these macroscopic finding tells us that there has been a struggle for life. Okay, now let's see our next question, which is basically a question where we need to give single best combination answer. Okay, still the only a single answer has to be given, but now the format changes a little. Rather than a single best answer, it is single best combination. Let's try this question. The question is, for a contributory negligence, it is contributory. Okay, read the following lines. The negligence is by patient only. Foundation has respondent superior. Defense for doctor in negligence cases, or negligence by doctor and patient. Okay, so what exactly are the correct statements? That is what we need to identify in this question. So if we talk about contributory negligence is a scenario where the patient has contributed upon the negligence of a doctor. So doctor plus patient both have contributed to negligence, which means option number 4 is a true statement. Correct? Now, contributory negligence helps a doctor to take a defense in civil negligence cases. For example, in a civil negligence case where a patient has gone to the court to claim compensation from a doctor, claiming that a doctor has been negligent in his treatment, because of which the suffering of the patient increased, and he wants compensation for his increased suffering. And then doctor comes to the court to defend himself, and doctor takes the plea of contributory negligence, and doctor establishes contributory negligence in the court of law, stating that the patient also contributed to the negligence, because of which he himself is also responsible for the damages that has happened to him. Not only doctor is not that doctor alone is responsible, patient also is responsible. In those scenarios, if the defense of contributory negligence that has been offered by the doctor is accepted by the court of law, and the court of law thinks yes, the negligence has been contributed by both doctor and patient, thus the onus of sharing the compensation for damages is upon patient also. So let's say a contributory negligence plea is accepted in a case by the court of law, and the court of law says that in this case doctor contributed 50% and the patient contributed 50% for the negligence, and the compensation amount is fixed at 1 lakh rupees for the damages that has been suffered by the patient. Now the doctor have to pay only for his contribution, that is 50%, which is 50,000 rupees. That is how it helps a doctor to defend himself, not completely, but to marginalize the contribution that he needs to pay as compensatory damages, which means option number 3 is also correct. And because option number 4 is correct statement, then option number first is a false statement, because option number says that contributory negligence is negligence by patient only, and option number 2, which says foundation has respondent superior, is also a false statement, because respondent superior is in the foundation of a concept called as vicarious liability. Okay, and so what do we see? That in this case option number 3 and option number 4 are two correct statements, which means the single best combination is option number A, that is 3 and 4. Okay, so the concept of these kind of questions is still the same. We are still marking the single best answer, but just by giving a different twist to the MCQ, the understanding of the question becomes slightly more complicated. Okay, so we need to practice these kind of questions also to master our ability to handle the question in quickest possible time during examination. Let's see another one. It is still a single best combination, and this time with the single best combination, a picture has also been added in the question itself. So the question is, first of all you need to look at the picture, and the question says, for the injury consider the following statements. So if we want to answer this question correctly, what do we need to do is, first of all we need to understand what the injury is. Otherwise we won't be able to answer the question correctly, because in the description of the question it is not mentioned what exactly is the injury. The injury here is a grazed abrasion. Now that looking at the picture we have understood that the injury is grazed abrasion, then we can come back to the question and start to see what kind of statements are given around it. The statement is, it involves epidermal damage only, which is a true statement, because in grazes or in abrasions actually only epidermal shedding happens. Sometimes true dermis also gets involved, but primarily it is an epidermal injury. Ante-mortem scab is concave in shape. So when an abrasion happens and later on the scab develops on the denuded epidermis, the scab is never concave if it is an ante-mortem injury, because the scab which develops over the epidermal deficit, the cellular proliferation will happen beneath that scab to heal the injury, to form a new skin, and as a result over a time the scab becomes convex in appearance. So concavity of a scab basically is telling us about that the injury is a post-mortem injury, not an ante-mortem injury. Okay, so this will be a false statement. Third, seen most commonly in road traffic accident, which is true. Grazed abrasions are very common in road traffic accident. In fact, their presence onto the body in an alleged case of a road traffic accident highly turn the case towards road traffic accident itself. Most of these grazed abrasions developed as a result of tertiary impact. Okay, so when we talk about road traffic accident, we talk about primary impact, secondary impact and tertiary impact. So they are tertiary impact injury at that point of time when the person slides onto the road because being hit by a vehicle. That point of time, because of the tangential grazing, grazed abrasion develop on his body. And then Fourth is developed due to perpendicular impact of blunt force, which is again a false statement, because as I just said, grazed abrasions are result of friction injury, sliding injury. So tangential impact with a rough surface on the body is what produces grazed abrasion. So what we see is that statement number 2 and 4 are correct, rest of them are wrong. So the best option which is telling us that 2 and 4 are correct is option number D in this case. Okay, now we move to a different kind of question which actually asks us to answer single best combination. Okay, so a question is given to us, and then the option has combination of certain things that may be happening, or depending upon what has been asked in the question, and we need to answer the single best combination. Let's try this question also. The question is, the correct sequence of finding meningeal bleeds in cranial trauma in autopsy is it subdural followed by extradural followed by subarachnoid, or extradural followed by subarachnoid followed by subdural, or subarachnoid followed by subdural followed by extradural, or subarachnoid followed by extradural followed by subdural hemorrhages? See, what question is asking is, when we conduct autopsies in cases of head traumas, which is the bleed which has been seen most, followed by little less, followed by least. Okay, so in cranial traumas there could be three kind of meningeal bleeds: subarachnoid, subdural and extradural, depending upon which space that bleed gets created or which space the bleeding happens. In cranial traumas, when we conduct autopsy, the most common bleed that is encountered is subarachnoid hemorrhage, followed by subdural hemorrhage, and least is extradural hemorrhage, which means option number C is the correct answer. But then you need to remember one very important thing. Although the sequence is correct, extradural hemorrhage, as we see, is the least common bleed seen in cranial traumas during autopsy. But extradural bleed is the only bleed which is specific to cranial trauma only. Extradural bleed is the only bleed which is specific to cranial trauma only. Why? Because extradural bleed does not develop in trivial cranial traumas. Okay, to produce an extradural hemorrhage, it requires an intense cranial trauma. Okay, so they are result of intense cranial trauma only. So extradural bleed don't happen in non-traumatic conditions, and they don't happen on intense without intense cranial trauma. So one thing which is absolutely attached to majority of extracranial bleed is presence of a fracture of skull bone in the vicinity of extradural hemorrhage. Why? Because if extradural bleed requires an intense cranial trauma for its development, that intense cranial trauma shall fracture the skull also. The thing to remember is 95% of extradural hemorrhage are associated with skull fractures. 5% is a rarity when there could be a development of an extradural hemorrhage, but there may not be any skull fracture in the vicinity. Okay, and as such, the appearance of extradural hemorrhage in cranial traumas is only in 1 to 3% cases. So extradural hematomas or extradural hemorrhages are extremely rare, and out of those rare cases, it is still an extreme rarity that it may not be associated with a skull fracture. So these are some important points to remember about the hemorrhage. Okay, now we see another kind of question format, which is called as an extended matching kind of a question format. Extended matching kind of a question format, where a table is given containing two different columns, and we need to match the contents of the column correctly. Okay, let's try and do this question. It takes a little more time also sometimes. So in this question, in column number 1, name of certain tests are given, and then in column number 2, certain findings are given. We need to match the test with its appropriate finding. The tests are Takayama test, Teichmann's test, Barberio's test, and Florence test. So 2 of these tests are done for detection of blood, and 2 of them are done for detection of semen. So if we see Takayama test, when we conduct Takayama test and we watch the slide microscopically, all these tests are microscopic tests. So you conduct the test on a slide and then you watch that slide microscopically. In Takayama test, we end up forming crystals which are called as hemochromogen crystals. Okay, so Takayama matches with hemochromogen, that is 1 matches with B. Then Teichmann's test is conducted and it ends up generating hemin crystals. Okay, so 2 matches with C. Barberio's test, it generates spermin picrate crystals, so 3 matches with D. And Florence test, it generates choline iodide crystals, so 4 matches with A. So correct answer would be 1B, 2C, 3D, 4A, which is given in option number D. So this is the kind of answering that we need to do in these kind of extended matching type of questions. Now in this extended matching type of questions, what do you see is that what is the basis or the principle of the test, or any other important academic activity that you may be needed to know about the test is not important. Like, it's not important what is the specificity of Takayama, what exactly is done in Takayama, why are generation of homochromogen crystals, how do hemochromogen crystals look like on microscope. Similarly, what are spermin picrate crystals, how do they look like in microscope, what is their morphology, what is their color. Anything is not important. Only correct matching of the contents of the table is what we need to answer. So even if we have some kinds a superficial knowledge, okay, these kind of questions can actually help us scoring better, okay, because sometimes these kind of extended matching questions does not ask you to show up deep knowledge about the area or the content. Okay, let's move further and let's see one more extended matching kind of a question where a photograph also has been included now. So there is a photograph and the question is the product obtained from the plant R, and then we have a combination A, B, C, D, stem, bhang, flower, charas, leaves, ganja, and there is a combination of altered substances. So basically, as such, the option is telling us that we are looking at the plant which is called as the cannabis plant, okay, and from cannabis plant we get three products, that is bhang, which is obtained from leaves. As you dry the leaves and crumble them, that's bhang, and then you get ganja, which you get from flowers, and then you have charas or hashish, which we get from stem. So correct combination is bhang coming from leaves, ganja coming from flowers, charas or hashish coming from stem, and this correct combination is given in option number C. From stem we have hashish, from flower we have ganja, from leaves we have bhang. Okay, few important things to remember about cannabis plant though is the active principle here is tetra hydro cannabinol. The active principle here is tetrahydrocannabinol, and the representation of this active principle in different products is different. Bhang contains THC level 15%, ganja contains THC level 25%, and charas or hashish contain THC in the concentration of 35 to 40%, which means bhang is the least potent product from the plant and charas or hashish is the most potent product from the plant. Now we come to another kind of question which is simply picture based question. Okay, so a picture is shown and something about the picture has been asked, that's all. There is no extended matching, there is no any other inference that we need to draw from picture. Simply look at the picture, answer the question. Okay, these questions are expected to be coming a lot in an examination, provided that now examinations are computer based examination and a very crisp images can be shown to you. Okay, so look at the picture. The picture not only shows you that a test has been performed, the name of the test is also given in the picture itself, and the question is very simple. The test shown in the picture is used as A confirmatory detection of semen, screening of blood, or screening of semen, or confirmatory test for blood. The correct answer is option number B, that this test which is shown is used for screening of blood. So if we see the tests used for screening of blood are: number 1, benzidine test. The color product produced in benzidine test is blue. Then O-tolidine test. The color again which develops is blue. Then Kastle-Meyer test. As you can see, the color develops in this test is pink. And fourth is leukomalachite test, where the color that develops is green. Okay, all these 4 tests are important tests for screening of blood, and they work on a principle, and that principle is the principle is detection of peroxidase enzyme. Okay, peroxidases are present in human blood also. Peroxidases are present in vegetables also. So peroxidases can be of organic origin, they could be of vegetable origin. The idea of conducting these tests is to the sample which is being tested. Okay, to the sample, let's say the sample is blood, you add benzidine reagent. Let's say we are doing benzidine test, so you add benzidine reagent. Benzidine reagent basically is a colorless reagent, and you add hydrogen peroxide. Now if the benzidine gets oxidized, it will change its color to blue. For benzidine to get oxidized, we have added hydrogen peroxide, but to release oxygen from hydrogen peroxide, we need peroxidase, but we haven't added peroxidase into the reaction. But if the sample is human blood, peroxidases are present in RBC, the reaction will go through, and a blue color will generate, provided that sample is blood, because if it is blood, it will provide peroxidases for the reaction to go through. And this is why we say that the whole screening process is basically to see whether peroxidase enzyme is present or not. And because this test only tells whether the peroxidase is present in the sample or not, that's why it is of screening value, because peroxidases can be present in human blood as well, they could be seen in vegetable matter. So we cannot always be sure that it is human blood only. Even vegetable origin peroxidases can make the reaction go through. Okay, let's see the next question. So the next question is again a picture based question. Okay, it's not an extended matching picture based question, it's a simple picture based question. The question says, for the injury which is shown in picture, all statements are correct except. Now, for answering the question, we should first of all be able to answer the injury correctly by looking at the picture. So the injury that we look at in the picture is an incise wound. Okay, is an incise wound. Okay, and if we talk about incise wounds are which kind of wounds? They are wounds which are caused by sharp edge of a weapon. They have regular margin. They are three-dimensional wound, that is they have length, breadth and depth, where length is the greatest dimension, and these injuries show feature of tailing at the rear end, where the incision would be ending, that's where the tailing would develop. So these are four fundamental informations that every student should be having in their mind every time they examine an incision. What are the four important information? Produced by sharp cutting edge, three-dimensional injuries, length is the greatest dimension, shows the feature of tailing, that is the ending area of an incision, and fourth, regular margin. Okay, so what do we see is given in the option? It is caused by a pointed weapon. No, it is caused by sharp cutting edge of a weapon. Produced by sharp cutting edge of a weapon, correct. Length is the greatest dimension, correct. Margins are regular, correct. Okay, so for the injury which is shown in the picture, all the statements are true except, so the statement which is not true is option number A, that it is produced by a pointed weapon. Remember, when we say a pointed weapon, it's a weapon which has a pointed end. Okay, lots and lots of sharp cutting edges, that is weapons like knife which have sharp cutting edge, they tend to have a pointed end also. But to produce an incision, the pointed end is not important. What's important is that weapon should have a sharp cutting edge. Because if we have a weapon like this, let's say a broken iron rod with a pointed end. So even this weapon has a pointed end, but you'll not be able to produce an incision with this because it does not have a sharp cutting edge. Because it's an iron rod, beyond the pointed end, the rod is blunt. And similarly, if you have, let's say, a weapon like this, let's say a knife like this, which has a sharp cutting edge, but it does not have a pointed end, it can still produce an incise wound. So what exactly we require to produce an incise wound is now clear to us, that we require a sharp cutting edge, not a pointed end. Now we see one of the, again, an important type of question. Okay, these are called as reason assertion type of question. So two statements are given to us in this question. One is an assertion, and then one is supposed to be a statement which is reason for, or it is alleged to be the reason for that question. What we need to decipher is that whether reason and assertions are correct statements, and if both of them are correct, is the reason the correct reason or appropriate reason of the assertion. If not, then we have to answer the options accordingly. So let's say the assertion is, in freshwater drowning, people die of arrhythmia. The reason is, there is efflux of water from vascular circulation to lungs in freshwater drowning, causing hyperkalemia. Okay, let's try and understand a case of freshwater drowning. To understand that, let's say this is an alveolus and this is a vessel around alveolus. In drowning, when the water is entering into the respiratory tract, the terminal portion where the water will reach the last is alveolus. Okay, correct? So in freshwater drowning, the water which is reaching the alveolus is hypotonic as compared to blood. So this water is hypotonic, I am showing it by down arrow, as compared to blood which is present in the vessel. So comparatively the blood is hypertonic. Okay, so water is hypotonic, the blood is hypertonic comparatively. And because a tonicity gradient is established between the two fluids separated by permeable membrane, to maintain the isotonicity now, the water flows from hypotonicity to hypertonicity. As a result, there is hemodilution, because lot of amount of water is coming from lungs into the vessel, so there is hemodilution, and so RBC swelling and rupture, and thus hyperkalemia, and this hyperkalemia will cause cardiac arrhythmia. Okay, so the whole sequence is water exiting from the lungs to go into vascular circulation, thus leading to hyperkalemia and arrhythmia. So the assertion that in freshwater drowning people die of arrhythmia is correct, but the reason that there is efflux of water from vascular circulation to lungs in freshwater drowning causing hyperkalemia is wrong. Rather, there is efflux of water from lungs into vascular circulation. Okay, and so if we see the options which are given to us, that assertion and reasons are individually correct and reason is correct explanation of assertion, that's not true. Assertion is correct but reason is incorrect statement. It seems to be the most appropriate answer right now, because assertion is correct and reason is an incorrect statement altogether. Then assertion and reason are individually correct but reason is not the correct explanation of assertion. This is also not correct because reason is a false statement, and assertion and reason both are incorrect statement is also not a correct statement. So correct statement is given in option number B, that assertion is correct but reason is an incorrect statement altogether. Okay, another question that we are dealing with today is multiple true and false. So this kind of a question can also come, but the chances of these kind of questions coming in an examination where the set pattern of the examination is such that you just need to answer one single best response. Okay, these kind of multiple true and false question used to come earlier in PGI kind of examination, but now that all examination has been combined into one single one, IMI CET, but still we are expecting some questions in those format also to be multiple true and false. So let's try and do this pattern also. The question is, mark the statements as true or false in sexual identification. Okay, males have long bone epiphyseal closure earlier than females. It's a false statement. Females tend to have long bone epiphysis closing earlier than males. Okay, dental eruption occur earlier in lower quadrant, which is a true statement. Okay, remember, dental eruptions, they occur earlier in lower quadrant as compared to upper quadrant. Then skull suture closure happen earlier in males. This is also a true statement, and this is one of the only exception that you should remember, because you can remember it as an exception, that some kind of a bony phenomena that happens earlier in males as compared to females, and that is closure of skull suture. It happens earlier in males as compared to females. And then fourth is endocranial skull suture closure precedes ectocranial skull suture closure. That is also true statement, and endocranial suture may precede the ectocranial suture by 5 years. What we meant to see here is, let's say we are examining a skull from outside and we see that sagittal suture is still visible. That is, the suture closure has not happened yet. It's not a plain area as of now. And if we would be seeing that vault from inside at the same point of time, so if we cut the vault and see from the inside surface, we might just find that sagittal suture from inside may have been closed completely. So what we are actually saying is that endocranial suture closures, they precede the ectocranial appearance of suture closure. The difference between them may be as wide as 5 years. Okay, and one last question for the day. The question is, the line representing rigor mortis in the graph of PM changes is, we see 4 lines of different colors in this graph. The first line is line of rigor mortis. Look at how the temperature of the body is higher to begin with, and then it goes down with the changing times. Okay, so this line is representing rigor mortis. We can remember this line as sigmoidal curve also. And then we have red line representing rigor mortis, the parabola, because you can see it starts few hours after death here, and then it goes up and it peaks here only to come down and disappear completely from the body, because it comes back to the same axis here. That is exactly what happens with rigor mortis. Okay, this blue line is line which is telling us about post-mortem staining, as it starts to develop few hours after death, and then it kind of deepens and it is seen, and then it never actually gets abolished. It kind of merges with the decomposition, which is shown by this green line, starting around 18 hours and then constantly progressing upwards as the body gets older and older and older after death. So something that keeps on progressing as the body gets older after death, or with increasing time after death, is has to be the decomposition or destruction of body. Okay, something which peaks but then comes back completely is rigor mortis. Something which starts from the peak and then gradually comes down has to be algor mortis, or the post-mortem cooling of the body. And something that start to develop after few hours and gradually peak and then kind of plateau is going to be post-mortem staining, because once it develops it never goes off. Okay, so the correct answer in this case is red line, which is depicting the concept of rigor mortis. So these kind of explanatory phenomena question can be asked in the examination. See, in this question we are basically attempting explanation of a phenomena. Okay, so these are variety of questions that can be thrown to us in an MDMS entrance examination. My idea was to just to give you an idea and a highlight a starting point for all those students who will be starting up their preparations, that reading the content is one thing, but simultaneously while we are reading the content we need to put up a good eye on various graphs, various photographs, and then we need to practice a lot of questions which are based on graphic memory, photographic memory, extended matching types where columns are to be matched, multiple options correct but single best combinations. So the information can be asked in variety of ways, and we need to practice these questions time and again, so that even if we know the best of our to the best of our knowledge, even if we have good information, we must not consume lot of time in answering a question जिसका सेटअप थोड़ा डिफिकल्ट है. ठीक है, बिकॉज एग्जामिनेशन में हमें सिर्फ सही आंसर नहीं करना क्वेश्चन, हमें वो सही आंसर लिटिल पॉसिबल टाइम में करना है. एंड दो स्टूडेंट्स who are able to answer the question correctly in smallest possible time, they have lot of time in their hands if they do encounter a question जिसमें उनको थोड़ा सा सोचना या दिमाग लगाने की ज़रूरत पड़ने वाली है. ओके, और ये सारी टेक्निक कैसे डेवलप होती है? ये सारी टेक्निक डेवलप होती है बार बार इन क्वेश्चंस को समझने की, देखने की और उनको प्रैक्टिस करते रहने से. चलिए आज की क्लास यहीं खत्म करेंगे. रिमेंबर, यू कैन कैच मी एट टेलीग्राम ऐप. द लिंक वुड बी livedaily.me/neetpg for any of your queries. For all those students who are looking forward to begin their preparation for their NEET PG examination, I told you in the beginning, Unacademy provides two lovely formats of subscription for you under Plus and Iconic headings. Classes are live in structured batches. Even if you do miss your live structured batch class, the playback recording is available for you. आप उस रिकॉर्डिंग को जितने मर्जी बार देख सकते हो. टिल द टाइम यू आर अ सब्सक्राइब्ड स्टूडेंट, देयर इज नो अपर कैपिंग कि आप कितने घंटे तक वो प्लेबैक देख सकते हो. आप कितनी भी बार वो वीडियो लेक्चर्स देख सकते हो, और उसके बावजूद आपको कोई क्वेरी होती है, यू कैन कम इन लाइव डाउट क्लियरिंग सेशंस विद योर एजुकेटर. किस तरीके से इंटरफेस वर्क करता है? क्योंकि वेब बेस्ड अप्रोच है, आपके टेलीफोन में भी एप्लीकेशन के थ्रू ये पढ़ाई आप कर रहे हो, तो आपको अगर ये चीज़ देखनी है कि ये इंटरफेस कैसे वर्क करता है, लाइव क्लास में मैं किस तरीके से पार्टिसिपेट कर पाऊंगा, टेक्नोलॉजी की प्योरिटी क्या है, वो चीज़ें आप गॉज कर सकते हो बाय वॉचिंग और बीइंग अ पार्ट ऑफ स्पेशल क्लासेस जो कि अनअकैडमी के प्लेटफॉर्म पे आपको मिलेंगी एब्सोल्युटली फ्री. स्पेशल क्लासेस हर एक एजुकेटर के द्वारा क्रिएट की गई क्लासेस होती हैं जो अनअकैडमी के प्लेटफॉर्म पे होती है लाइव. आप अनअकैडमी के प्लेटफॉर्म पे जाइए, जो भी अनअकैडमी एजुकेटर के द्वारा आने वाली इन फ्यूचर स्पेशल क्लासेस है उसमें यू कैन एनरोल एब्सोल्युटली फ्री, एंड देन यू कैन बी अ पार्ट ऑफ लाइव स्पेशल क्लासेस फॉर एनी सब्जेक्ट. surgery, dermatology, pediatrics, you name it, and you've got special classes there. Once you have been through special class session, you simply would not stop yourself from getting an Unacademy subscription. और वो कैसे लेना है आपने? वो आपने लेना है कि आपने Unacademy का ऐप अपने फ़ोन पे डाउनलोड करना है. अगर आप ऐप डाउनलोड नहीं करना चाहते हो, if you are somebody who is working on laptop or desktop, you can create your login ID at unacademy.com, and once you have done either of them, simply go to manage goal section, pick up your goal, select what kind of subscription do you want, plus or iconic, and take the subscription. आप जो चूज करोगे वो सब्सक्रिप्शन आपको मिल जाएगा. अगर आप प्लस सब्सक्रिप्शन चूज करते हो, आइकॉनिक भी अगर चूज करते हो, तो मेरी रिकमेंडेशन ये है, गो फॉर बल्कियर वंस. ओके, उसके बेनिफिट्स मैं आपको पहले ही बता चुका हूँ. सबसे इंपॉर्टेंट बेनिफिट है, आप कमिट हो जाओगे अपने गोल की तरफ. मेरा रेफरल कोड रहेगा DRSUMITLIVE. इफ यू चूज टू यूज दिस, यू विल गेट 10% डिस्काउंट जो भी सब्सक्रिप्शन आप चुन रहे हो. ओके, प्लस और आइकॉनिक सब्सक्रिप्शन के बीच में थोड़ा सा डिफरेंस है. आइकॉनिक सब्सक्रिप्शन में आपको प्लस के सारे बेनिफिट मिलते हैं, उसके ऊपर आपको प्रेप लैडर का ऐप सब्सक्रिप्शन भी मिल जाता है. दैट्स कॉल्ड एज आइकॉनिक. सो आइकॉनिक इज बेसिकली प्लस subscription, and on top of it prep ladder's app subscription. You get both. It does require a little more premium, but then referral code वहाँ पर भी वर्क करता है. Remember, my referral code is DRSUMITLIVE. ये रेफरल कोड आप यूज कर सकते हो, ये रेफरल कोड आप शेयर कर सकते हो किसी के साथ भी. वो कोई भी प्रोडक्ट सब्सक्राइब करना चाहे अनअकैडमी से, उनको 10% का डिस्काउंट मिलता है. ठीक है, चलिए आज के लिए हम अपनी क्लास यहाँ रोकते हैं. विल मीट अगेन इन आवर सेशन with some new concepts or a new topic for discussion in the subject of forensic medicine. Till then, bye, take care.